The correct answer is B, the convenience and broadening role of telemedicine. In the first paragraph, Dr. Linda Shaw emphasizes how telemedicine is expanding beyond its original uses and making healthcare more accessible and convenient. She states, from chronic disease management to urgent care consultations, telehealth platforms are enabling broader access and greater convenience. This clearly reflects the growing scope and ease of access that telemedicine offers, which is exactly what option B conveys. The other options, while they may seem plausible, do not accurately reflect Dr. Shaw's point. Option A discusses the role of telemedicine during the COVID-19 pandemic, which is mentioned in the paragraph, but that point is made by the narrator, not Dr. Shaw. Option C is misleading because it mentions chronic disease management, which Dr. Shaw does include, but she lists it alongside urgent care, showing that telemedicine is not used exclusively for one purpose. Finally, Option D refers to the original purpose of telemedicine, serving remote patients. But again, this is part of the paragraph's background information, not the main point Dr. Shaw is making. Her emphasis is clearly on how telemedicine is evolving and becoming more integral to healthcare today. The correct answer is C. They questioned its effectiveness compared to in-person care. In the second paragraph, the writer clearly states that, quote, early skepticism toward telemedicine centered on concerns about its clinical effectiveness. This means that many healthcare providers were doubtful about whether remote care could match the quality of traditional face-to-face consultations. Their concerns were specifically tied to the limitations of not being able to perform physical examinations or assess patients in person, which are crucial elements of clinical care. Now, let's look at why the other options are incorrect. Option A, which talks about legal uncertainty across state lines, isn't mentioned at all in the paragraph. There's no discussion of legality or jurisdiction. Option B, which suggests that providers thought patients would be unwilling to use telemedicine, also isn't supported. In fact, the paragraph highlights that patients with chronic conditions like hypertension and diabetes reported high satisfaction with virtual care, which contradicts this idea. Option D, suggesting telemedicine was viewed as useful only in emergencies, also doesn't fit. The paragraph actually makes the opposite point, that telemedicine has been shown to be effective for non-emergency conditions. So overall, the skepticism was mainly due to doubts about how clinically effective telemedicine could be compared to traditional, in-person treatment, exactly what option C captures. The correct answer is B. It improves access and encourages ongoing care. In the third paragraph, Dr. Samuel Ortiz emphasizes that telemedicine is making a major difference in rural areas by helping patients stay more engaged with their healthcare providers. He specifically says, we've seen patients who previously missed appointments due to travel or time constraints now engage regularly with their providers. This quote highlights two key ideas: improved access to healthcare and increased ongoing participation in care, exactly what option B states. Now let's go over why the other choices are incorrect. Option A, it reduces specialist waiting times. Sounds plausible, but it's not mentioned in the paragraph. While telemedicine may help with wait times in some settings, this passage focuses on physical access and follow-up engagement, not scheduling efficiency. Option C, which says it eliminates the need for local practitioners, is misleading and inaccurate. The paragraph doesn't suggest replacing local healthcare providers. Rather, it talks about supplementing local care by providing access to services that are otherwise geographically out of reach. Finally, option D, it reduces logistical and geographic obstacles, is close, but not quite as specific or accurate as option B. While the paragraph does mention removing geographical barriers and travel challenges, the quote from Dr. Ortiz places greater emphasis on how that improved access leads to consistent engagement with care, which is a more complete summary of his point, making B the better choice. The correct answer is C. It is linked to positive health outcomes for certain conditions. In the second paragraph, the writer explains how earlier doubts about telemedicine were largely due to worries about whether it could match the effectiveness of in-person care, especially since doctors couldn't perform physical exams. But the paragraph then tells us that, quote, multiple studies have demonstrated that, for many non-emergency conditions, virtual care is comparable in quality to in-person visits. This is key. It's followed by, patients with conditions such as hypertension, diabetes, and anxiety disorders have reported high satisfaction and improved outcomes. This clearly implies that patient satisfaction isn't just about liking the convenience, it's tied to better health results, particularly in managing chronic conditions. That's exactly what option C states. Now let's talk about the other options and why they're not correct. Option A. It is mainly observed in patients with mental health conditions is too narrow. Yes, anxiety disorders are mentioned as an example, but so are hypertension and diabetes, which are physical health conditions. So this answer distorts the broader point being made. Option B. It improves only when physical exams are not required, is misleading. The paragraph does mention that physical exams are a limitation of telemedicine, but it doesn't say that patient satisfaction is only present when physical exams aren't needed. Instead, the satisfaction is associated with specific manageable conditions, not the absence of physical exams. Lastly, option D. It reflects general attitudes toward non-traditional medicine, introduces an idea that's not in the text at all. There's nothing here about patient views on non-traditional medicine or broader philosophical acceptance. Just concrete results in specific clinical contexts. So C is the most accurate and supported by the passage, linking patient satisfaction directly to improved outcomes in certain conditions. The correct answer is B. Lack of technological confidence limits telemedicine use. Let's break this down in a conversational way. In paragraph 4, the author is highlighting some of the ongoing barriers that prevent telemedicine from reaching everyone equally. A key issue mentioned is technological barriers, especially for the elderly and low-income groups. The paragraph says, not everyone owns a smartphone, has a stable internet connection, or feels confident navigating digital platforms. That last part, feels confident navigating digital platforms, is the key phrase that supports option B. It directly implies that some patients lack confidence when it comes to using technology, which in turn limits their ability to benefit from telemedicine. Now let's look at why the other options are not correct. Option A. Patients often use outdated hardware and software, might sound reasonable, but the passage doesn't specifically mention anything about outdated tech. It only says not everyone owns a smartphone or has reliable internet, not that their devices are old or ineffective. So this is an overinterpretation. Option C. Providers are not trained to assist with tech issues, also isn't mentioned anywhere in the paragraph. The focus here is on the patient's challenges, not the providers. So this choice adds a detail that isn't supported by the text. Option D. Patients are unwilling to share data due to privacy fears. Misrepresents what the passage says. It does mention concerns about data privacy and cybersecurity, and that breaches have made people wary. But it doesn't go so far as to say patients are unwilling to share data. That would be a stronger claim than what the passage actually makes. So the best supported answer, based on a careful reading, is B, because the passage clearly states that a lack of digital confidence is one of the barriers to accessing telemedicine. The correct answer is B. The elderly may be disproportionately excluded by digital care. In paragraph 5, the focus shifts to a deeper concern about inequality in access to telemedicine, especially for vulnerable groups. Dr. Nina Kapoor, a geriatric specialist, highlights that while telemedicine can expand access for many, it may inadvertently leave out certain populations, particularly elderly patients or people with disabilities. The paragraph notes that these individuals might find it difficult to use video-based platforms, especially if they depend on caregivers who aren't available to help during virtual appointments. Dr. Kapoor states, technology can be a double-edged sword. We risk leaving vulnerable populations behind, which clearly points to the idea that older adults are at risk of being excluded if telemedicine systems aren't designed with their specific needs in mind. That's exactly what option B is summarizing. Now, why are the other options incorrect? Option A, digital platforms require professional caregivers to assist during calls, distorts the paragraph's message. While it mentions that some elderly patients rely on caregivers, it doesn't say professional caregivers are required, only that their absence may create difficulties. So this choice adds detail not found in the text. Option C, remote consultations are too costly for vulnerable groups, isn't mentioned at all. The paragraph focuses on accessibility, not cost, as a barrier to telemedicine. Option D, elderly patients benefit less from wearable technology, is irrelevant in this context. The paragraph doesn't mention wearable technology. It's only concerned with video-based consultations and the risks of exclusion. So the best and most accurate answer is B, because it captures Dr. Kapoor's warning that the elderly and disabled may be disproportionately disadvantaged in the growing digital healthcare landscape. The correct answer is A. Technology has both benefits and potential drawbacks. In paragraph 5, Dr. Nina Kapoor uses the phrase, "Technology can be a double-edged sword," to express the idea that while digital healthcare tools, like telemedicine, can greatly expand access and improve convenience, they also carry the risk of excluding certain populations if not carefully designed. Specifically, she's referring to elderly patients or those with disabilities, who may struggle with video consultations, especially when they lack support from caregivers. The phrase double-edged sword is a metaphor that commonly means something that has both positive and negative consequences. In this context, it highlights the tension between innovation and inclusivity. Telemedicine is beneficial for many, but without thoughtful design, it could worsen healthcare inequalities. Let's look at why the other options are incorrect. Option B, digital tools will eventually replace in-person care, is too extreme and not supported by the text. There is no suggestion in the paragraph that in-person care will be completely replaced. In fact, the entire concern raised is that technology might not work well for everyone. Option C, virtual care only works when caregivers are involved, oversimplifies the issue. The paragraph does mention that caregivers can play a helpful role, but it does not say they are the only way virtual care can succeed. The main point is about accessibility, not dependency. Option D, certain tools work better for certain age groups, while it sounds plausible, is too general and not specific to the meaning of the phrase double-edged sword. The paragraph does discuss challenges for older adults, but the phrase itself refers to the mixed impact of technology overall, not just differences by age group. So, the best interpretation of double-edged sword in this context is A, because it captures the idea that technology can help some people while unintentionally creating barriers for others. The correct answer is C. A blended model combining virtual and physical care is ideal. In paragraph 6, Dr. Shah offers a clear and optimistic vision of the future of healthcare. She suggests that telemedicine is not meant to replace traditional in-person care, but rather to complement it. The paragraph introduces the idea of hybrid approaches, where patients receive a mix of virtual and face-to-face care depending on their individual needs. This flexible model is becoming more accepted as both technology and healthcare systems evolve. Dr. Shah's quote at the end reinforces this balanced perspective. The future of healthcare isn't about choosing between digital and physical, it's about integrating the best of both worlds for optimal patient outcomes. This line directly supports the idea that the blended model, or integration of both forms of care, is considered ideal for the future. Let's now examine why the other options are incorrect. Option A, wearable devices may replace face-to-face appointments, exaggerates the role of technology. While the paragraph mentions wearables and remote monitoring, it doesn't suggest they will replace in-person visits altogether, just that they will enhance virtual care. Option B, telemedicine will eliminate the need for hospitals, is not mentioned or implied. In fact, the paragraph emphasizes that traditional care remains necessary, and telemedicine is meant to work alongside it, not eliminate it. Option D, traditional care methods will remain superior to virtual ones, is inaccurate. The paragraph doesn't place one approach above the other. Rather, it stresses integration and balance as key to better outcomes. There's no suggestion that either method is inherently superior. Therefore, C is the most accurate conclusion drawn from Dr. Shah's comments. It captures the central message of integration and the growing shift toward a hybrid model of healthcare.